Howard.
Hello.
My name is Rachel. I'll be the nurse practitioner doing your exam today.
Okay.
Now I understand, do you like to go by Chris?
Yeah, that's fine.
Okay, very good. Now I understand the nurse had you empty your bladder, and I see she got you into a gown and took your vital signs and your height and weight. Is that correct? Okay,
She did.
very good. And all of those look normal, your vital signs look great.
Good.
So first off, I'm going to start by looking at your head. Now with everything, I always inspect first before I touch. So everything looks symmetric, color, warm and dry. Your eyes look even with your ears, which is exactly where they need to be. And then I'm going to run my fingers through your scalp. I'm going to be noting any tenderness or swelling, nodules, any bone deformations or anything like that, okay? Now you kind of look to your left for me, and I'm going to run my fingers through. Do you have any tenderness?
No.
Okay. Now your hair is evenly distributed, so everything looks good. I didn't notice any nodules or abnormalities. Now I'm going to look at your sinuses, and I'm just going to kind of palpate with my thumbs, okay? Any tenderness?
No.
Very good. Any tenderness with that?
Mm-mm.
Okay. I'm just going to take a light now. I'm going to shine into your sinuses, and this way we look to see if there's any extra fluid, okay? So open your mouth, please. Keep your mouth open. Now you can close your mouth. Okay, very good. Now I'm going to assess your jaw. I'm just going to put my hands here and have you open your jaw. Very good. And move your jaw back and forth. Very good. Okay. So now I'm going to look at your eyes, and noting your eyes, everything looks good. There's no abnormal drainage. They're symmetrical. So next I'm going to test your vision, okay? So we're going to look at this chart back here. It's called a Snellen chart. And I'm going to have you cover one of your eyes, and you can try to read the bottom, like the smallest letters that you can, okay?
E-J-R-F-G-O-D.
Very good. Now with your other eye.
E-J-R-F-G-O-D.
Very good. Now I'm going to have you look up, and I'm going to just look at your lower eyelids and see if there's any drainage or hemorrhages. Everything looks good. Now close your eyes, and I'm just going to gently palpate your lids. Okay, very good. Okay, and I'm just going to take my ophthalmoscope light and look into your lenses. Okay, very good. Now I'm going to look at your ears, and everything, like I said, looks symmetrical. Color is good. I'm going to lightly palpate. Can you have any tenderness?
No.
Okay, I'm not noting any nodules, so that's a good sign. Any tenderness over here?
No.
Very good. Now we're going to do a couple hearing tests. The first is a whisper test. And in this, I'm going to first stand on this side of you. You cover that ear, and I'm going to whisper something to you. You repeat it back, and then we're going to switch, okay?
Okay. T39.
Very good. Now let's do it with the other ear.
T39.
Very good. Now I'm going to take my tuning fork, and I'm first going to place it on the top of your head, and it's going to be vibrating. You're going to hear that. You tell me if you're hearing it in both ears equally or one more than the other, okay?
Okay. Okay.
You stop hearing it?
Uh-huh.
Okay. Did you hear it in both ears equally?
Yes.
Okay, no more than the other?
No.
Okay, next I'm going to take my tuning fork and place it on either side, right in front of your ears. You're going to tell me when you stop hearing it, same as the other test, okay?
Okay.
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 Okay, very good. And now I'm going to place the tuning fork about 1 inch from your ears on either side. You tell me when you stop hearing the noise, Okay?
Okay. Okay.
Very good. Now I'm going to take my otoscope and look in your ears at your tympanic membrane. Everything looks normal. We like to see pearly gray, so that's what I see. Don't see any fluid or bulging. Next I'm going to look at your nose. So from what I can see, everything looks like it's midline. I'm next going to take my light, have you look up. I'm just going to push your nostrils up a little bit and look inside at your nostrils, make sure everything is midline, there's no blockages, your septum looks good. Okay, thank you very much. All right, now I'm going to look at your mouth. So externally, I can see everything looks good. Your lips look moist and pink, and I'm going to have you open your mouth and show your teeth for me. Very good. Your gums look pink, no bleeding or swelling. You have all your teeth?
Uh-huh.
Can you open up your mouth and let me look at all your teeth? Very good. Your gums look good. Stick out your tongue for me. Okay, go ah. Okay, very good. So next I'm going to look at your neck, and from what I can see, everything, like I said, symmetrical, no nodules, it looks smooth. I'm going to palpate your trachea and your thyroid, okay? So your trachea. Next I'm going to do your thyroid. I'm going to have you look to your left and slightly down. Okay, and the other side. To your right and slightly down. Very good. Now I'm going to assess your carotid pulses. And I'm going to listen to your carotid pulses as well as your thyroid. Okay. Very good. Next I'm going to palpate your lymph nodes. So I'm going to start behind your ear, go in front of your ear, the base of your skull, a little bit further down your jawline, your tonsillar lymph nodes. Okay. Supraclavicular, and now your nodes right below your clavicles. Okay. Next I'm going to look at your arms. So I'm just going to have you extend your arms real quick. I'm going to look at your right arm first. Just looking at your skin, hair distribution, nails all look good. I'm going to palpate your joints. Can you tell me if you have any tenderness?
No.
Okay. What about in your wrists?
No.
Your hands?
Everything's fine.
Okay. Do the same with this arm. Very good. Okay. Any tenderness?
Mm-mm.
Wrists?
No.
And hands?
Mm-mm.
Okay. Next I'm going to palpate your radial pulses in your wrists. Okay. And your brachial pulses. Very good. Next I'm going to have you sit on that edge of the table, and I'm going to look at your back. Okay. So I'm just going to kind of open up your gown. Very good. So like always, I'm just inspecting for symmetry and contour. From what I can tell, your respirations are non-labored, so that's a good sign. I'm next just going to lightly palpate. Okay. Next I'm going to do a test in which we kind of test the vibration when you speak. So I'm going to place my hands on the back of on your back, and you're going to say 99.
99.
Very good. And then I'm going to place my hands on either side where your kidneys are, and we're gonna test for kidney tenderness, okay? I'm gonna kind of pound against my hand. Any tenderness?
No.
How about there?
No.
Okay, good. And next I'm going to test for what we call diaphragmatic excursion. This tells us how much your diaphragm moves when you inhale and exhale. So first I'm going to have you take a breath in and out and hold it after you breathe out, okay? Tell me when you're ready.
Okay.
Hold it. Okay? And now I'm going to have you take a deep breath in and hold it when you're ready. Okay, very good. So you can let your breath out. And the difference was about 4 centimeters, so that's exactly where we need to be. It's about 3 to 5 centimeters that we want it to be. Now I'm going to just listen to your back, your lung sounds. Deep breath for me. Good. Okay. Now come around back to the front. And now I'm going to assess your heart and your front chest. So we're going to put your gown down to your lap. Okay. And again, non-labored respirations, everything looks symmetrical, musculature is intact. All right, so I'm going to begin by lightly palpating and looking for the point of maximal impulse, as we call it, where your heart tone is felt the best. Very good. Now I'm just going to do some percussion, which is that tapping. And in this way we see the margins of your heart if your heart is enlarged at all, okay? Very good. Now I'm going to listen to your heart tones. Start at the aortic valve point, pulmonic valve, another pulmonic valve or Erb's point, tricuspid valve, and mitral valve. Okay. Now I'm going to look at your abdomen. So I'm going to have you lay down with your head at this end, and I have a pillow for you. Just get comfortable. Okay. You can put your arms at your sides or whatever's most comfortable for you. I might have you move a little closer this way. Very good. Okay. So as always, I'm just going to inspect the contour. Everything looks good. Color, hair distribution. Now I'm going to listen to your belly. Now I'm going to listen to the various arteries. First, the aorta, then the renal, and the iliac, and the femoral. Okay. Now I'm just going to percuss, which is that tapping again, and here I'm going to try to find the margins of your liver, okay? Very good. Now I'm going to lightly palpate your abdomen. Do you feel any tenderness with that?
No.
Okay. I'm going to palpate your aorta to assess for the direction of blood flow. going to deeply palpate. And first I'm going to begin with your abdomen and then go to your liver, spleen, and both of your kidneys, okay? Very good. Now for your liver. And your spleen. And your kidney. This time I'm going to have you take a deep breath in and I'm going to lift up on your back, okay? Very good. And same with your right kidney, I'm going to have you take a deep breath in. Very good. Okay. And we are done. You may sit up. Okay, you can put your gown back on. There we go. Now I'm going to lift up your gown a little bit and look at your legs and feet. Again, like I did with your arms, noting skin, hair distribution, your nails. I'm going to just lightly palpate, looking for elevated temperature, any swelling or anything like that. Looks like we're good. I'm going to palpate one of your pulses. And your other pulse. And popliteal behind the knee. Okay, very good. Next we're going to test your neurologic system, and in this test we do 12 cranial nerves. Now the cranial nerves, the first one is the olfactory nerve, and this tests your sense of smell. Do you have any issues with smell or taste?
No.
Okay. So I have a scent here, and I'm going to have you plug one of your nostrils, close your eyes, and take a deep breath when I walked it under your nose, okay? So go ahead and close your eyes and cover one of your nostrils, and take a deep breath in. Okay, what do you think that was?
Peppermint.
Very good. Now do the same with the other nostril. Deep breath. Okay, what do you...
Peppermint again.
Very good. All right, next we have the optic nerve. And we already tested some of your vision with the Snellen chart. Next, I'm going to have you hold a card that I have here. Hold it at a reasonable distance. Cover one of your eyes and read the smallest letters that you can.
EJRFGOD.
Very good. Now do the same with the other eye.
EJRFGOD.
Very good. Okay. Thank you. Next, we're going to test other tests of your eyes. We're going to do your visual fields and your peripheral vision. Okay. So I'm going to have you look at my finger, and you're going to follow my finger with only your eyes. Don't move your head. Okay. Very good. Next, I'm going to have both of us cover one of our eyes, and I'm going to test your peripheral vision, okay? So which eye would you like to cover first?
This is fine.
Okay. Tell me when you first see my hand.
Okay. Okay. Okay.
Okay, now let's cover the other eye.
Okay. Okay. Okay.
Okay, very good. And the next is just looking at how you're opening and closing your eyes. Looks like you're having no trouble with that. Okay, the next one is your trigeminal, which I'm going to place my hands on your cheeks, and you're going to clench your jaw and move your chin back and forth. Very good. Next, I'm going to test your facial nerve, and this is a series of facial expressions. So clench your eyes shut for me. Open them up real wide. Wrinkle your forehead. Frown for me. Smile. And purse your lips. Puff your cheeks. Very good. Okay. Now I'm going to test your acoustic nerve, which is hearing. Now we tested a couple hearing tests earlier. This time we're going to rub my fingers together on either side of your ears, and you're going to tell me if you hear both of them or one or the other. Okay?
left, right. That's both.
Very good. Alrighty, now we're going to test the glossopharyngeal, which is your swallowing. I just want you to take a simple swallow. Very good. Next is your vagus nerve, in which you just say ah, and I'm going to look at your mouth. Say ah. Good. Okay. And next we have the spinal accessory. So I'm going to push down on your shoulders and you're going to resist against me. And then I'm going to hold one of the side of your cheeks and resist and opposite. Okay? So hold, hold, hold. Okay? Hold, hold. Hold, hold. Okay, very good. The last one is the hypoglossal, which I'm just assessing your tongue, okay? Your tongue movements. I'm going to have you stick out your tongue, move it side to side. Very good. Now push it against the inside of your cheek, and I'm going to push against it. Good. And the other side. Very good. Next I have a couple objects, sharp and dull, that I'm going to rub against your feet, and you tell me which one you're sensing, okay? We're testing your sensory function. So I want you to look away during this time and tell me what you feel.
Sharp.
Okay?
Dull.
Very good. Now your other foot.
That one's dull.
Okay?
Sharp.
Very good. Okay. Next we're going to test your musculoskeletal system. So I'm just testing the strength of your muscles. We've tested your shoulders. I want you to move your neck around side to side, up and down. Good. Now I'm going to have you resist against my hand, okay? Move it up and down, and we did side to side already. So I'm going to have you put your arms out for me, and I'm going to push down on your arms, and you're going to resist, okay? Hold, hold, hold. Good. And you're going to try to push down. Hold, hold, hold. Good. Now we're going to do the same with your hands, okay? So I want you to extend your hands, and I want you to push down against me. Hold. Good. And pull up. Good. Now the same with this. Push down. Pull up. Good. Okay, so now I want you to kind of scoot towards the end of the table, and I'm going to test your hip muscles, okay? So first I'm going to have you push up against my hand, okay? Hold, hold, hold. Good. Next with your other hand. Good. Okay, and now I'm going to have you try to move your knees apart and then push them together, okay? Hold, hold. Good. Push them together. Good. Okay, now we're going to test your lower legs. So I'm going to have you resist against my hand again, okay? Good. And try to bend your knee. Good. Resist. And bend your knee. Good. Okay. Next I'm going to have you stand. And you're going to push up on the ball of your foot, testing your calf muscles. Good, okay? Kind of sit back on the table again. I'm going to have you elevate your toes, and I'm going to push down. You're going to resist against me. Very good. Okay. Well, you did a great job, Mr. Hubbard. Is there anything else I can do for you?
I don't think so.
Okay. Well, it was very nice to meet you, and you have a good rest of your day.
Thank you.
I'll let you get changed back into your clothes.
Okay, thank you.
Okay.